Hello, and welcome to another episode of Your Public Health Professional and You, a program of the Maryland Public Health Association. I am Lillian Agbeyegbe, your friendly community health educator. The Maryland Public Health Association is promoting public health professionals because we like you, members of our community, to know who are these people working behind the scenes for you and what are they doing and why does it even matter to you as a person. So I am very excited to be talking to another phenomenal public health practitioner today, Kimberly Green-Warren. And Kimberly, please, can you just say hello to our viewers today?
Yeah, absolutely. It's great to be joining you this evening. My name is Kimberly Green-Warren, and I am the founder of Smart Health Education, a Maryland-based consulting practice that works with individuals, teams, and organizations to design engaging learning experiences, really focused on expert training design as well as leading facilitation.
Awesome. So I hear that, and my head is going bing, 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 expert training, design, communication. And this is the work that you do with public health practitioners?
Yes. So I am someone who helps professionals help themselves. So I would say that I am really focused on professional development within the public health space and really creating engaging learning experiences that empower public health professionals with the knowledge and skills to do their job better. We know that we are COVID has proven that to us. We are in a ever evolving, changing world. And I want to make sure that public health professionals can really take all the ideas that we see around us, all of the knowledge that surrounds us, and making sure that we are in the know about the latest trends, the latest knowledge, the latest skills related to the work that we do. So I'm really, really focused on workforce development as a whole, as well as just increasing workforce capacity within the public health sphere.
Awesome. Workforce development and increasing public health capacity. The public health professionals, of which I am one, do a lot of work around members of the public. And like you said, you're helping them, train. They've already graduated from school, right? So you're working outside with people who have graduated from school. Tell me, how do you get your clients? What's an example of some public health, some training initiative that you have implemented for these practitioners to implement?
Yeah, absolutely. So some examples of work that I am currently focused on is one, helping even in the healthcare space, helping like physicians and nurses, particularly with culturally competent care. So making sure that they have the knowledge and skill set. That may not be a class that you take. It may be one or two classes that you took somewhere throughout your career trajectory, going through med school or going through nursing school, or even in your undergrad or graduate program, but making sure that you have the latest information on how do you actually provide culturally competent care, right? I'm also working on another project really focused on early career professionals and their career development and really identifying, okay, once I graduate from this fellowship and this experience, what do I do next? What are the possible avenues in public health? Is it certifications? Is it an internship? Is it finding another similar position? What type of employers? How do I make myself most marketable in the public health job market? What are my skill sets? So helping early career professionals in particular identify the most aligned career pathway for them within public health.
Awesome. I will come back to that, but I wanted to go to messaging and communicating. So public health professionals have these unenviable task, if I may call it so, of telling people not to eat what they want to eat because, of weight, or telling people to put on their seatbelts or use the car seats and things like that. What sort of education do you think that is very helpful to public health professionals to be able to carry out that mandate of educating, creating education and awareness in our communities?
So just to clarify the question, maybe, do you want me to respond to what I believe is the most effective way?
Yes.
Okay. So most effective way, I apply this philosophy regardless if I'm working with a community member versus a public health professional or an organization, is to meet people where they are, right? My goal is not to ever place my own goals and ambitions on someone else, right? So the best thing that I believe that we can do as public health professionals, particularly when it comes to education, is to meet people where they are. In this ever-changing world, there's a variety of ways to do that. I think traditionally we've assumed that the only place to meet people where they are is through a one-off workshop or training or single learning experience is what I'll call it. However, public health has an amazing opportunity in this content overload world, if you will, to meet people where they are, which is online, right? Through various social media platforms, particularly. It's through connecting through various ways that people connect online as well, through discussion boards, through Facebook groups, through other community-based apps. There's opportunities to provide education there, one-off, maybe like it's a one-off tip on particularly with their whatever the health issue that we're particularly talking about, or even skill-based, like I was talking about earlier, how you can do your job better. There's also opportunities to partner with folks who are already in the same spaces that our community members are, such as other community related events, right? That maybe have nothing to do with health, right? Maybe it's a school-based program, even though we know everything is public health, so excuse me, but it could be a program primarily focused on the education, right? Within your local community. If that's where folks are, then we want to provide the education tied with where folks are. So I'd say there's just a variety of ways I can think: in person, virtual, even hybrid, to educate folks. But first, again, meeting them where they are, identifying what their primary source of information is, where they find the most trust, right, in that information, and then providing, maybe it's like one-off tips, or maybe it's a longer extended workshop or training program, just based on whatever the needs are.
Absolutely. That's phenomenal. Finding what the trust is, meeting people where they are, might be a one-off or can be something longer. Now, I know earlier I said I was going to come back when you said you were helping young professionals to decide whether they're going to go in the public health field. So I wanted to find out, who helped you make that decision? How did you get into public health, and how did you decide to end up in consulting?
Yeah, absolutely. So my public health story is actually not too dramatic. I am someone who loved public health from pretty much day one. I went to the University of Georgia, so go Dogs. I moved to Maryland about almost 10 years ago. And when I was at the University of Georgia, I initially, from freshman year, thought I wanted to be a doctor, like many folks in public health, because of my heart of service. I wanted to give back. I wanted to save folks. I wanted to make sure that they were well. And I realized very quickly from taking Chemistry 101 that this was not the right path for me. And the University of Georgia had a College of Public Health. And from there, I looked into public health. I said, yeah, this is perfect. So I did health education from pretty much my sophomore year of undergrad, and I've been doing health education ever since. So I've just worked in a variety of capacities, as you can imagine. From undergrad, I started in community gardens and working on I worked on a stress study, really understanding folks' cortisol levels within Athens, Georgia. From there, I wanted to go to grad school. So I'm from Atlanta. So I naturally thought I needed to go to Emory for grad school. And so I got into Emory, went to orientation, and then decided I didn't want to go to grad school anymore. Shocker to everyone in my life. But from there, I took a year off and did AmeriCorps. And so I went to the public health. I was a part of the Philadelphia Health Corps. And from there, I had a year of service, loved it, worked in an elementary school. really running health and wellness programs for K through 8th grade. It was life-changing. I love the experience. I am the biggest AmeriCorps fan, and I always encourage young professionals who may feel stuck or may feel uncertain about what path they want to take within public health to please consider AmeriCorps.
Wow.
It's an amazing opportunity to gain valuable on-the-ground experience and, most importantly, give back to communities who need it the most. And I also am so enthused by the fact that we have the Public Health AmeriCorps program now. When I was a part of it, it was just AmeriCorps. And even though we had a Philadelphia Health Corps and there were other health corps across the country, but now we have Public Health AmeriCorps as a result of the pandemic. And I encourage young professionals, again, to strongly consider AmeriCorps if there's anything that you're hesitant about starting school again, or, or not sure of what certification, just to gain more on the ground experience. But basically from there, I'll fast track post AmeriCorps. I went to grad school, so I did end up going back.
Wow.
And I graduated with my MPH. And then from there is really where I started focusing on workforce capacity, workforce development within the public health space. And so since we're based in the DMV area, I've worked with a lot of national public health organizations as well as healthcare. And I've even ventured out into affordable housing as well as behavioral health, and working in a variety of capacities to really empower professionals with the knowledge and skills that they need to do their job better, on a wide range of topics like social determinants of health, cultural competency, leadership development, and everything that kind of like falls in between. And so that led me to consulting because as you climb up the career ladder, I realized very quickly that I no longer wanted to necessarily like manage folks. And I never really wanted to, be CEO, even though I am CEO of my own consulting practice right now. And I truly wanted to like do the work, know? And I was getting to a place where I was managing consultants when I wanted to actually do the work that we were outsourcing to consultants. So that's really what the first instinct that switched my brain to like, maybe I could do this. And so I love curriculum design. I love workshop design. I love facilitation. And so by having my own consulting practice, I'm allowed to do the work, which I love. And it's
That's phenomenal. I don't think I've heard that before about, that sort of trajectory of saying, this work we're outsourcing to consultants is something I love and I can do myself. So I will set up shop.
Yeah.
Very, very interesting. Thank you so much for sharing that.
Yeah.
So we've gotten to the point where, very fascinating story, by the way, of your journey. And then you're working with people to decide what track to go into in public health. Let's dial that back a bit what about the person who hasn't come into public health yet?
Yeah.
Sitting on the fence who, either they're just going to school or they're already working what would you say is kind of like the selling point for public health? What would you say was the unique selling point for public health that you can pitch to a young person, maybe in high school, or who's thinking about a career change about public health being the place to go to?
Yeah, absolutely. I think about this a lot because when folks when folks share their public health journey or their like career trajectory within public health, I do feel like there is a universal quality to all of us that are in public health, and that is a heart to give back. I think all of us have this unifying quality that we want to, one, cheesy, make the world a better place, right? We want to give back. We want to serve. And I believe that regardless of, we know that everything is public health. Everyone can't see that, and I understand that. But I do think that there is room for you, you as any public health, or any person considering public health, there is room for you in public health if you in any shape or form have a heart of service. Because everything that we do is really in service of the public and making sure that folks are well, making sure that folks have the proper resources, the tools, the education, right, to live healthy lives within their own homes and their communities. And so I think there's space for everyone there's space for anyone who has a heart of service in public health. And I think that's the beauty of it, along with the wide variety of roles, responsibilities, tasks that you can take on. If you want to be an epidemiologist and focus on data, you can do that. If you want to be someone like me who loves health education and helping someone, you can also own your own consulting practice, right? You can work at the state level, you can work at the national level, you can work on the local level on any topic you could possibly think of. So I think the variety of opportunities within the field and the unifying quality around service and wanting to give back and making our state, our communities a better place, there's room for whoever wants to join us.
Wow, that's very interesting. One thing that really stood out to me, is the fact that anybody who has a heart of service, if you want to give back to others, join this field. Some of the things that we hear from the others is we don't even know who you guys are. We don't know who your public health practitioners are. So here you say, a common thread among public health professionals is they have the heart to serve other people. So what do you say to someone who says, I don't even know who you guys are. I think you guys are meddling in my affairs for telling me, say, I need to vaccinate or I need to sanitize my hands or something. You don't see me, you don't know me. What's your message to the general public about public health practitioners?
The note about public health practitioners, I think it's twofold, right? I think it's a conversation with the public, right? About who we are, what we do, right? It's very clear if I use the analogy of a firefighter, right? It's very clear when your house is on fire that the person that's coming to save you is the firefighters. We're going to call the firefighters. They're going to come put out the fire and we're going to be well. Right? It's not as clear to the general public what the fires look like within public health and how we're actually saving the public because of that, right? So something very simple as sanitation, right? And just making sure that hotels, restaurants are following our sanitation codes, right? And making sure that you aren't being served that is expired, right? And there's certain sanitary guidelines that every hotel, every restaurant, every establishment has to follow for us to be well. That's not a fire that everyone is going to visually see on a day-to-day basis. Why? Because we make sure that you never see the blazing fire, right? But there are absolutely firefighters that are public health professionals behind the lines every single day, making sure that we are all well. So I think with the general public, it's explaining and sharing what those fires are that we're constantly putting out that they may not be able to see. And just because they're invisible does not make them any less of a fire than a firefighter, right?
Absolutely.
And then with public health professionals ourselves, we need a conversation with ourselves, right? I think tied to the heart of service, we also could afford, this may be controversial, to toot our own horn a bit more than we do. Okay? I don't think that public health as an industry is very loud. And we're not ones to toot our own horn and say, did you see us put out that fire? Do you know who we are? Do you know what we do? We're like, we'll sit in the background. That was us. That's okay. Not us, And I think that alone, it allows for other industries to take the gold star, to say that was me, right? When really it's public health. So I think it's kind of a conversation with the public. It's also a conversation amongst ourselves about how we share what we do, but perception is reality. That's very real in the world that we live in today. So I think it just takes a lot for us to also just consider, for us to evaluate how we're perceived and the impact it has on our actual reality, which is oftentimes undermined.
That is so profound. It's so profound. And it's reminding me of when I worked at the National Center for Healthy Housing. I worked on building codes, and it was my first time property maintenance code. And I found out that there's actually a distance from the houses that trash bins have to be in a housing complex. And that's a public health code that you can't just, yes, you can have trash bins, but you can't just have them like right in front of somebody's door. It has to be a certain distance. I'm like, oh my goodness. Water coming out from the faucet has to be between certain temperatures. So there's no way somebody is going to be turned on the tap absent-mindedly and their skin is going to be scalded with the hot water coming because the temperature is regulated. And somebody knows it can't be beyond this temperature. Somebody has decided what's the burn temperature, and that's it. I don't know who those people are, but I turn my tap every day and I'm safe because somebody has negotiated that. You don't have mice running into the house, because somebody has made sure that trash is collected at a certain time. It can't be more than this and all of those things. So that is really, really interesting. Thank you so much. And I like the conversation you also said about, public health professionals not touting their horn, how we have to do a better thing about saying we are here and we are pulling our own weight and we have a seat at the table, which we deserve, where we deserve to be.
Yeah, for sure.
Speaking about that, that's one of the things we try to do in the Maryland Public Health Association. We have the association come together, professional members, and it provides us the opportunity to ask ourselves these tough questions and to say, what are we going to do? We're an affiliate of the American Public Health Association, which, oh my goodness, if you have been to an APHA convention.
Yeah, I love APHA.
It's like
overwhelming.
It really is overwhelming.
Yeah.
We don't have that overwhelming impact at the state level, at the Maryland state level, even though we have many public health professionals, but not everybody is a member of the Maryland Public Health Association. What would you suggest to the Maryland, just as you suggested to public health practitioners, how we need to consider tooting our horns a little bit more? What would you suggest to the Maryland public health professional about getting non-members to join the association so that we can, have these conversations and see what we can do differently?
Yeah, absolutely. I think about this a lot too within my work because, as I mentioned, most of the time I work with public health professionals to help themselves, right? Through training, design, meeting, facilitation. And I will say that one of the universal qualities through the work that I do, that I find that regardless of when or how you bring folks together, the biggest value add for a lot of professionals, particularly public health professionals, is connection, right? Connection is key. There's a lot, even though you can meet people, there's very few people that you meet and understand what it's like to work within public health, understand the challenges, understand the unique opportunities, right? And also understand what your day-to-day looks like. And I think Maryland Public Health Association over APHA, which is super large, I'm a huge advocate for it. I love going to APHA and just learning from folks, is that Maryland Public Health Association has a unique opportunity to bring Marylanders together. We also work within a very unique context within Maryland, right? And Maryland, I told you I'm originally from Atlanta, but I love Maryland because the geography is vast. When you go from the east to the west, it's wild. You can go through so many different towns, counties that are vastly different from one another. But it's also very unique to Maryland as well. And so I think Maryland Public Health Association has a unique opportunity to connect professionals who understand what we're facing as Marylanders, and also provide the space, the platform for folks to connect with folks who are doing something similar. And maybe it's from county to county, or maybe it's, it's within similar organizations, but different cities, right? But I think that Maryland Public Health Association is just an amazing platform to learn from other professionals, connect with other professionals that you wouldn't have the opportunity to do without the existence of the organization.
Absolutely. Thank you so much. You wouldn't have the opportunity to learn from other professionals. That's one of the things a lot of people say, the opportunity to network, the opportunity to have, communities of practice and learn from ourselves within the association. Kimberly, it's been so wonderful talking to you, learning about your past to public health and the work that you do with the training and keeping the force equipped to do their work, your advice to young professionals who are in the field finding a path for themselves or just thinking about coming into the field, your message to the general public about, we put out fires even though you don't get to see them, and to us as public health practitioners about, hey, we need to step up our game in terms of engaging the public some more. I just wanted to give you a chance to say anything else you wanted to put in this conversation that I haven't had the opportunity to ask you for.
Not at all. I think my universal message is, I think post-COVID, we're at an interesting place with public health and where it goes next. Mm-hmm. And I will say that I am particularly excited about the energy that I feel within the field, to really want to take the lessons from COVID and use that to accelerate what's next, right? And so I hope that we'll use that energy to garner new strategies, to continue to make an impact, and then obviously to improve the health of individuals and communities. So
awesome. Thank you so much. Thank you for joining us on another episode of Your Public Health Professional and You. I've been talking to Kimberly Green-Warren. If you have missed the conversation, you can go back and watch it from the beginning. Very engaging conversation. I'm Lillian Agbeyegbe, your friendly community health educator. Until I come back to you again with another episode of Your Public Health Professional and You, thank you for joining us. Bye.
Bye.